Okay, I just got a call that I need to go to the patient's room and manually ventilate the patient. I went ahead and checked the chart, but you don't have any trauma to the neck or head, so I'll go make sure I grab my supplies. I need an Ambu bag and some different oral pharyngeal airways. So upon entering the patient's room, I'll go ahead and use some hand sanitizer, put on some gloves, and bring my airways over. I'm going to measure. I'm going to see if there's any consciousness with the patient. Mrs. Smith, my name's Kate from Respiratory. Introduce myself. Even if the patient isn't responsive, I can go ahead and say that out loud and let her know that I am here, just in case she can hear me but just can't respond. So we'll go ahead and measure. This one is way too short. It should go to the tip of her ear from her mouth. That one is way too short there. So this one we'll go ahead and check. And that one looks like a proper one. So upon inserting, I'm going to go ahead and do a chin tilt here. Insert upside down, pulling or pushing down on the tongue. Halfway, I'm going to go ahead and 180-degree twist. That flange is going to sit right there on the patient's mouth and secure airway. Now I'm going to go and hook up my Ambu bag that I brought, set up the oxygen flow, and with my hand here, have a chin tilt. Make sure I have a tight seal around the patient and start administering breaths. We want to do it at a rate in between 12 to 20 breaths per minute. What I'm looking for is chest rises, that the patient is getting air into their lungs, and also allowing my Ambu bag to completely fill. The patient had a CHF patient. Actually, I believe the breaths per minute is going to be 8 to 10. You do not want to over-oxygenate a CHF patient. But I will continue doing this until I have further instructions if we're going to intubate the patient or if the patient starts breathing on their own. But we do have, if she does have some spontaneous breathing, I'm going to try to make sure that I administer the breaths with her breaths.